And
How do you choose where to get started then? Like when it comes to, okay, we could do counseling, we could go for the supplementation route, we could go, you know what I mean? Like patients are going to say, okay, well, I've only got so much time, so much money. How do you start whittling that down to what's going to work the best?
well, it's a good question. And when it comes to clinical practice, I want to be also very clear. I am not suggesting that you start by giving people nutraceuticals as primary treatments for the disease of depression. If I were suggesting that, then I could take my product off the market and skulk away to some desert island because the FDA wouldn't let me live in this country. However, if you begin treatment, as most doctors do, with an SSRI antidepressant for
Yep.
someone who's mildly to moderately depressed, again, if that person either is in therapy or, as often is the case, doesn't want to do therapy because they just want to get better and they don't want to talk to anybody. That's
All
not
too
an
common.
unusual scenario. In those cases, you start them on the SSRI, and rather than jumping onto some other drug, if the SSRI is inadequate to their needs or if they have too many side effects at a therapeutic dosage, my next step is to add the nutraceuticals. And I used to tell people, okay, go to Amazon and purchase S-adenosylmethionine. Make sure it's a good, reputable seller. Make sure that it's a 400 milligram tablet. Make sure you take 4 of the 400 milligram tablets daily for maximum response. Then, when you've done that, go buy some fish oil, but it has to be triple strength fish oil. It contains a lot of EPA. Or the third thing, please go get a medical food, which was already available as a medical food at the time, which is L-methylfolate or Deplin. And then you can take all these three things together in a giant bowl while you're taking your antidepressant and dealing with depression. Many people have the self-discipline to do this. Many people do not. And so it was a limited sort of a phenomenon for me because it takes time to kind of figure out who is going to be able to do this and who's not. So the next thing I did was, well, you know what? Let's see if we can put these things together in one product, make it easy to take, and then the next step is once the antidepressant isn't working well enough, you add the new product. And it's a single thing. Mind you, I wish I could make it one capsule per day, but because of the volume involved in the fish oil, it's 2 capsules twice a day for the ideal dosages of all three items. But it's out there, and I'm marketing it as we speak.
Well, I think like the form factor and just making that roadblock or the hurdle that patients have to jump through in order to get to the treatment plan and like making it as smooth and frictionless as possible is super important. Like, I don't know, I have so many patients that just struggle with even the simplest of things, right? Like, okay, you got to do 5 push-ups a day and then we'll talk again next week.
Yeah,
Did
yeah,
you do
I know
it?
what you're saying.
No, I was gonna do it, but I didn't get around to it. And then we talk about like, okay, we got to go get a whole bunch of like chemistry lab sounding ingredients sourced off the internet and start putting together our nutraceutical um, supplementation plan. Patients are like, oh my goodness, it's probably pretty anxiety inducing. Versus if you have something that's just like off the shelf, easy, ready to go, that probably takes a big part of that roadblock out of there.
So far, we found that to be the case. And I've started off with the folks who are already in my practice, and a lot of times there are people who already are taking these three things, and we just replace it with this product. By the way, the product's name is Hedonia, in case you were wondering.